Pregnancy at 50 is a special, challenging, and meaningful journey. At this age, many women have experienced major changes in their health and body, and pregnancy requires careful preparation and a strong spirit. Unlike when you were younger, you can still have sex during pregnancy, but pregnancy at the age of 50 is a completely different story. Although age can bring certain risks to pregnancy, with care and adherence to reasonable health principles, women can still experience a safe and happy pregnancy. Therefore, the following article will introduce 7 things that women in their 50s should avoid during pregnancy, helping to protect the health of both mother and child. From controlling stress, maintaining a healthy diet, to regular health checkups, each plays an important role in ensuring a complete pregnancy. Before entering the video, please click the subscribe button to follow the latest health videos. Thank you. Let's start the video. First, 1. Avoid excessive stress and anxiety. Being pregnant at the age of 50 can bring many emotions, from joy to anxiety, especially when the changes in the body at this age can make the mother feel tired and stressed. Excessive stress not only affects mental health but can also cause health problems such as high blood pressure, headaches, and even more serious complications during pregnancy. When pregnant, the mother's body will have many changes, including hormones. This is the most common risk factor leading to depression in pregnant women. Changes in the body's hormones make the mother's psychology more sensitive and vulnerable, thinking and worrying more. Unwanted pregnancy makes pregnant women worry and have many negative thoughts because they are not really ready to welcome a child at this time. If this mentality persists, it can lead to depression during pregnancy. Nowadays, women are modern and quite independent. However, during pregnancy, if they do not receive care and support from their husbands and relatives, pregnant women are more likely to be depressed. Thyroid disorder. The thyroid gland is the organ that produces hormones for the body. If the thyroid gland is disordered, women's hormones will be affected and is also one of the risk factors leading to depression during pregnancy. Depression during pregnancy does not have clear signs and is easily confused with normal psychological changes in pregnant women, so it is difficult to detect. Here are some signs: frequent anxiety, stress, fatigue, sadness, depression, and frustration, often angry for no reason, crying, easily agitated, difficulty sleeping or prolonged insomnia, likes to be alone, does not like to socialize, interact with husband, family, friends, does not go for regular prenatal checkups, and does not trust doctors, has negative thoughts, even suicide, tends to like using stimulants such as beer, alcohol, cigarettes. Therefore, we need to do the following to reduce stress. Get enough sleep. Getting enough sleep will help the body regenerate energy for the next day, dispelling feelings of fatigue and lethargy. A deep sleep of 7-8 hours at night is really necessary for pregnant women. Exercise. Endorphin hormone. The happy hormone will be produced during exercise, helping you feel more refreshed and comfortable. Just doing light, reasonable exercise for 30-45 minutes a day will make pregnant women feel comfortable, eat well, and sleep better. Exercises that pregnant women can practice include walking, yoga, etc. Eat scientifically and healthfully. Eating healthy foods and drinking enough water will help improve your mood significantly. In particular, foods that are good for the brain often contain many amino acids and fatty acids such as beans, milk, fruits, etc. Write a diary. This is a very effective way to relieve stress. If you feel frustrated or uncomfortable, write a diary. This will help you feel more comfortable when you can express and confide. When pregnant, women have great changes in their psychology and physiology. Therefore, relatives and friends should pay more attention to pregnant women so that pregnant women always feel secure, cared for, and understood. This helps prevent depression during pregnancy effectively. If necessary, seek the support of a psychologist or mental health counselor. 2. Avoid unhealthy diet. Diet plays an important role in ensuring the health of both mother and child during pregnancy. Especially at the age of 50, the body's nutritional needs need to be fully met to maintain the best health. Nutrition is an important part of helping the mother stay healthy and the fetus develop comprehensively. A good diet is a diet with a balance of groups of substances such as carbohydrates, protein, fat, vitamins, etc. To help the fetus develop healthily physically and mentally, the mother needs to ensure nutrition during pregnancy in a scientific way. Supplement enough folic acid, iron, calcium, protein, zinc, vitamin D. In addition, the mother should clearly understand the list of what pregnant women should not eat and foods to eat during pregnancy to be able to best prepare for this 9-month pregnancy journey. An unhealthy diet can cause pregnant women to lack important nutrients, easily leading to health problems. Here are some healthy diets. Add protein and fiber. Protein-rich foods such as lean meat, salmon, eggs, and whole grains provide energy and essential nutrients. Increase vitamins and minerals. Dark green leafy vegetables, broccoli, beans, berries, nuts, and dairy products are rich in vitamins and minerals that are essential for the mother's health and the development of the fetus. Drink enough water during pregnancy. The mother's blood volume increases. Therefore, it is important for pregnant women to stay properly hydrated. Symptoms of mild dehydration include headaches, anxiety, fatigue, bad mood, and memory loss. In addition, increasing the amount of water pregnant women drink can help relieve constipation and reduce the risk of urinary tract infections. Make sure to drink 8 to 10 glasses of water a day to maintain metabolism and avoid dehydration. Limit processed foods. Fast foods high in sugar, salt, and bad fats can cause unhealthy weight gain and increase the risk of heart-related diseases. 3. Don't be too physically active. Exercise is important for overall health, but at 50 it's important to do it gently and appropriately. Exercise that is too strenuous or requires a lot of strength can put stress on the body, leading to risks such as miscarriage, injury, or fatigue. Do not exercise if you have the following health problems: heart disease or lung disease, cervical circlage, multiple pregnancies and risk factors for premature birth, placenta previa after 26 weeks, premature rupture of membranes or preterm labor, preeclampsia or gestational hypertension, severe anemia. Benefits of regular exercise during pregnancy: reduce back pain and pelvic pain, reduce constipation, prevent excessive weight gain, reduce the risk of gestational diabetes, preeclampsia, and cesarean section, improve overall fitness, strengthen the heart and blood vessels, help you lose weight after giving birth. Suitable types of exercise: gentle walking. This is the best cardiovascular activity, easy to do and does not put too much pressure on the body. Pregnant women are advised to practice 20 to 30 minutes a day. But yoga for pregnant women. Yoga helps increase flexibility, reduce stress, and make the body flexible. Increase flexibility, muscle strength, and respiratory function. Swimming. This exercise method has a low risk of injury. Swimming helps reduce pressure on bones and joints, especially when the belly grows. Breathing exercises and stretching. These gentle exercises help improve circulation and keep the body in a relaxed state. 4. Do not skip regular health checkups. At age 50, the risk of pregnancy complications is higher than in other age groups. A woman's reproductive organs and overall health are no longer ready for conception, pregnancy, and childbirth. At this time, ovarian function declines in women entering premenopause and menopause. The number of eggs capable of conception is very low. Furthermore, the eggs are more likely to have chromosomal abnormalities, making it difficult to conceive healthily, and the risk of miscarriage is higher. Older women are also more likely to have gynecological problems that affect fertility, such as uterine fibroids or endometriosis. These barriers make it more likely that even if women can conceive, their babies will be born with slow intellectual and motor development, because the older the mother is, the more likely the chromosomes in the eggs will stick together, causing diseases related to chromosomal disorders such as Down syndrome, Edwards syndrome, etc., etc. Therefore, regular health checkups are extremely important. Regular checkups help detect and promptly handle possible health problems, such as high blood pressure, gestational diabetes, and cardiovascular complications. At this age, we should pay attention to necessary tests such as pregnancy ultrasound is a method of examination using ultrasound waves to obtain images of the baby, as well as the placenta, uterus, and other organs in the mother's pelvis. Pregnancy ultrasound is a safe measure to help doctors monitor the progress of the fetus and detect early abnormalities, if any. So according to the advice of obstetricians, pregnant mothers should have an ultrasound at least 3 times during pregnancy to ensure the health of both mother and baby. Pregnancy at week 12. The first ultrasound of pregnancy is conducted at the gestational age of 11 weeks 6 days to 13 weeks 6 days. Tests at 12 weeks of pregnancy help doctors determine the most accurate gestational age. More importantly, at this stage, doctors can observe the nuchal translucency through ultrasound, thereby helping to detect early chromosomal abnormalities, Down syndrome, limb deformities, diaphragmatic hernia. If this time is missed, determining the nuchal translucency is no longer accurate. At 22 weeks of pregnancy, the internal organs of the fetus have fully formed. When observing the images obtained from ultrasound, doctors will know whether those organs are developing normally or not. The spine, skull, brain, heart, lungs, kidneys, limbs, placenta, and umbilical cord of the fetus at this stage can all be seen. In addition, the doctor can detect abnormalities in the morphology of the fetus, such as malformations of internal organs, cleft lip, cleft palate. Ultrasound at this stage is very important because if the pregnancy needs to be terminated, it must be done before the 28th week. Fetus at week 32. This ultrasound is performed when the fetus is 32 weeks old, helping to assess the growth of the fetus, detect some late occurring morphological problem, such as abnormalities in the arteries, heart, and brain of the 32-week-old fetus. In addition, it also helps the doctor recognize the condition of slow development in the uterus. This is the cause of fetal failure and asphyxia after birth. Although the abnormalities detected at this time are too late to intervene, the doctor can find the appropriate men at birth and prepare for timely care and treatment for the child afterwards. In addition to these three important ultrasounds, if there are any unusual signs during pregnancy, the pregnant woman must immediately go to a specialized medical facility for examination and timely treatment. Up to now, ultrasound is a safe diagnostic method, painless for mother and baby. Ultrasound does not use radiation, so there is no need to worry about dangerous complications of rays on health. There is no medical evidence that ultrasound is harmful to the fetus. However, this does not mean that we can abuse ultrasound. Ultrasound should be performed under the guidance of a specialist. Blood test. The purpose of blood tests during pregnancy is to assess the health of the mother and fetus and predict risks for pregnancy and childbirth. Based on the results of blood tests and general examination results, the obstetrician will have an intervention direction to minimize possible risks. Pregnant women need to have a blood test in the first 3 months of pregnancy. And this is the ideal time, however. If for some reason the pregnant woman has not had a blood test in the first 3 months of pregnancy, she needs to consult a doctor for appropriate treatment. Necessary tests during pregnancy. Blood type. Determine the blood type, OABAB, of the pregnant woman to prevent the need for a blood transfusion during pregnancy and childbirth. A typical example is when you have heavy bleeding, hemorrhage during pregnancy or childbirth. Rush factor. If the mother's blood type has the RAF factor while the father's is Raj, the fetus may carry the RAF factor, resulting in the mother's body producing antibodies that destroy the fetus's red blood cells. In this case, the doctor will inject Ray immune globulin into the mother's body to prevent danger to the fetus. Hematology. Assess whether the iron content in the body is deficient, leading to anemia. If so, the pregnant mother will be prescribed iron supplements. In addition, blood tests during pregnancy also detect blood cell disorders, sickle cell disease or thalassemia, causing anemia for both the pregnant mother and the fetus. Infectious diseases that are dangerous to the fetus. Check whether the mother is infected with rubella virus, cytomegalovirus, hepatitis B, HIV, syphilis, spirochetes, or not. From there, assess the level of risk for the pregnancy. Provide solutions to limit damage to the baby at birth. Suitable test is a test prescribed for all pregnant women in the first trimester or between the 9th week and the end of the 13th week of pregnancy. It is especially mandatory for pregnant women with a family history of birth defects. Pregnant women over 35 years old, using drugs or chemicals that can harm the fetus, having diabetes and using insulin, being infected with a virus during pregnancy, being exposed to high doses of radiation. Double test is performed by taking a blood sample from the pregnant woman to evaluate the concentration of free beta-HCG in PAPA, pregnancy-associated plasma protein A. This test allows the detection of about 95% of pregnancies with Down syndrome. Triple test, also known as triple test, is a screening test using a maternal blood to find out the risk of some congenital disorders in the fetus. There are 3 substances used in this test: AFP, HCG, and estriol. Gestational diabetes blood test. A blood test for gestational diabetes is usually done between 24 and 28 weeks of pregnancy. If a woman had gestational diabetes in a previous pregnancy or is at high risk of developing the condition, her doctor may recommend testing earlier. The test usually involves a glucose tolerance test, TEAT, so she needs to fast, not eat or drink, overnight before the test. If her blood sugar level is high on the TEAT, she will be diagnosed with gestational diabetes. If you have gestational diabetes, it means you have a high-risk pregnancy and need special care and management. If diabetes is not managed carefully, it can cause serious problems for the pregnant woman and her baby. Therefore, it is important to see an obstetrician to help control diabetes during pregnancy. In addition to blood tests, pregnant women may have to do the following tests during pregnancy: Urine test. Measure the amount of protein albumin nitrite in the urine to see if the mother has a urinary tract infection or gestational diabetes. Genetic screening test using chorionic villus sampling and amniocentesis, prescribed by the doctor in case of ultrasound images, or the mother is older, over 35, has a family history of genetic diseases, or the mother has given birth to a child with a birth defect. Chorionic villus sampling, CVS, conducted when the fetus is around week 10. 12. Analyzes chromosomal abnormalities of a sample taken from the chorionic brain surrounding the embryo, thereby diagnosing early chromosomal genetic diseases such as Down syndrome, Edwards syndrome. Amniocentesis, performed when the fetus is around 15 to 18 weeks old. A quantity of amniotic fluid containing cells from the baby's skin is aspirated for testing to screen for Down syndrome, neural tube defects, etc. Blood pressure check. Pregnancy-induced hypertension is a common medical complication in pregnant women and is one of the important causes of maternal death. For the mother, uncontrolled pregnancy-induced hypertension can lead to complications for the mother such as placental abruption, stroke, and organ failure. For the fetus, if the mother's body has pregnancy-induced hypertension, poor blood supply, the fetus may be underweight or malnourished. The most dangerous is premature birth, stillbirth, or being forced to give birth early to reduce the mother's illness, because most of the blood pressure disorders of pregnancy are significantly reduced after the fetus is born. At this age, we should prevent gestational hypertension. In addition to regular prenatal checkups and regular blood pressure measurements, pregnant women also need to adjust their diet and lifestyle to limit the risk factors that cause high blood pressure. Limit the use of salt in food preparation. Drink at least 8 glasses of water per day. Increase protein intake, reduce fried, stir-fried foods and snacks, get adequate rest. Exercise regularly. Avoid drinking alcohol, beer, and using stimulants such as caffeine. You can use additional supplements as directed by your doctor. Cardiovascular checkup. The mother's heart needs to work harder during pregnancy, so a cardiovascular checkup helps prevent serious problems. During pregnancy, women's heart and blood vessels undergo many changes. Changes in the cardiovascular system during pregnancy include increased blood volume. The body will increase blood volume by 40 to 50% in the first 3 months of pregnancy and maintain this level throughout pregnancy. Cardiac output will increase by 30 to 40% corresponding to the increase in blood volume. During labor, output may increase during uterine contractions, but decrease between contractions. After birth, there is an increase in blood volume returning to the circulatory system from the pelvis. Capillary beds in the placenta and lower limbs because the uterus is empty and the compression phenomenon has been released. Increased heart rate. The heart rate will increase by about 10 to 15 times minute compared to normal. Decreased blood pressure due to hormonal changes and increased blood flow directly to the uterus. In some pregnant women, blood pressure can decrease by about 10 mmHg compared to normal. Heart disease during pregnancy threatens the health of both mother and fetus. 5. Avoid exposure to toxic substances. At the age of 50, women's bodies have many health changes, and toxic substances such as chemicals and cigarettes, alcohol, pesticides, or strong detergents can cause more harm. These substances can affect the development of the fetus, especially the brain and internal organs. Ways to protect yourself. Avoid cigarettes and alcohol. Alcohol is one of the most toxic substances but is often used, causing serious consequences on the fetus: low birth weight, small head circumference, slow development, mental illness, muscle weakness. The more alcohol the mother drinks, the higher the toxicity rate on the fetus. Tobacco. Mothers who smoke can give birth to low birth weight babies, reduce head circumference, increase the risk of miscarriage, stillbirth, premature birth, because nicotine prevents the supply of oxygen to the fetus, and nicotine passes through the placenta easily. The concentration of nicotine in the fetus can be 15% higher than the amount of nicotine in the mother's body. In addition, nicotine can also be concentrated in amniotic fluid and breast milk. If someone else smokes and the pregnant woman inhales cigarette smoke, the consequences are similar to smoking directly. These are the top toxic substances for pregnancy, seriously affecting the health of both mother and baby. Use natural products. Prioritize cleaning and personal care products from natural ingredients, free of toxic chemicals. Wear gloves and masks when necessary. If you have to come into contact with chemicals such as detergents, remember to use gloves and masks to reduce the risk of absorption through the skin or respiratory tract. Choose a clean living environment. Avoid areas with dust or air pollutants. 6. Do not use over-the-counter medications arbitrarily. Age 50 often comes with a number of chronic health problems, and the need for medication may increase. However, during pregnancy, many over-the-counter medications can cause side effects or affect the development of the fetus. Antibiotics. Most antibiotics do not cause birth defects. However, there are some antibiotics that have negative effects on the fetus, such as tetracycline used from the 4th month of pregnancy, causing yellow teeth and enamel hypoplasia. Streptomycin and its relatives can damage the auditory nerve, leading to deafness. Antihypertensive drugs. In recent years, some new antihypertensive drugs have been shown to be associated with oligodramias and anuria in the fetus, although no cases of congenital malformations have been recorded. These drugs are contraindicated during pregnancy. Anticancer drugs used in the first 6 weeks of pregnancy often cause miscarriage. If used in the first 3 months of pregnancy, it can cause fetal growth retardation, abnormalities of the skull, limbs, and mental retardation. Some drugs can cause fetal malformations such as cleft palate, short limbs, genital malformations, etc. Anticoagulants used in the first 3 months increase the miscarriage, nervous system abnormalities, fetal growth retardation, stillbirth, etc. Heparin is an anticoagulant that does not cross the placenta, so it can be used in the first 3 months of pregnancy and lasts until the 36th week. Antiepileptic drugs can cause congenital malformations. Hydotoin can cause special syndromes in the fetus, head and face abnormalities, limb defects, mental retardation, cardiovascular abnormalities. Steroid hormones. Pregnant women are treated for threatened miscarriage with estrogen-progesterone combination drugs. Some notes when using drugs. Use drugs only when necessary and as prescribed by a doctor. All drugs used during pregnancy need to be carefully considered and should only be used when prescribed by a doctor. Inform your doctor about the drugs you are using. If you are taking drugs to treat chronic diseases such as blood pressure, cardiovascular disease, discuss with your doctor to have a suitable plan during pregnancy. Avoid using non-prescription pain relievers and anti-inflammatory drugs. These drugs can affect the nervous system and health of the fetus. 7. Don't overdo caffeine. Although caffeine can help you stay awake, consuming too much caffeine can be harmful to your baby, leading to the risk of premature birth, low birth weight, or other neurological development problems. Caffeine can cause high blood pressure, insomnia for pregnant women. Caffeine crosses the placenta, affecting the formation and development of the fetus and hindering the absorption of nutrients by the fetus. Do not consume more than 200 mg of caffeine per day. Good caffeine substitutes for pregnant women. Try drinking herbal tea, fruit juice, coconut water, unsweetened fresh milk, sugarcane juice, vegetable juice, or filtered water instead of coffee to reduce caffeine intake. In addition, we should be careful with caffeine in other foods. Soft drinks, chocolate, and some pain relievers also contain caffeine. Pregnancy at 50 is not an easy journey, but with the right care and a healthy lifestyle, women can absolutely have a safe and meaningful pregnancy. Paying attention to what to avoid helps reduce the risk of complications while bringing the best health to both mother and fetus. Hopefully the above video will bring a lot of useful information. Pregnant mothers can be more assured, proactively protect their health, and present their children for a healthy start in life. Wishing everyone good health to fully enjoy the joy and love of life. Thank you for watching the video.